Welcome back. If you have a Medicare plan, Ryan Dolan from our sponsors at Univera Healthcare is here to discuss what you need to know for 2025. Thanks so much for coming in today, Ryan.
Thank you, Chelsea. Glad to be here.
Of course. Let's talk about why the annual enrollment period is a good time to consider switching plans.
Yep, so the annual enrollment period runs from October 15th through December 7th, and that gives current Medicare members the opportunity to select coverage for the upcoming year. So late September, early October, Medicare members receive what's called an ANOC report. It's an annual notification of coverage. That'll spell out current benefits, any changes that are happening to their current plan. It's also very important to review additional coverage options for the year, right? So they want to really take a look, make sure that they're in the right plan for the upcoming year. 2025, even more important going into this year, as there are some headwinds. There's a little bit more disruption in the Medicare marketplace than what we've seen historically. So it's going to be very important, schedule time, make sure you're sitting down with a dedicated advisor and reviewing those plan options for 2025.
Okay. And can we discuss a little bit the difference between an HMO and a PPO plan?
A lot of acronyms in the Medicare.
Yes, there are.
But an HMO, and this is a great starting point as folks are starting to review their options. An HMO is a health maintenance organization. Okay? When folks hear that, they should really think of an in-network benefit. So when you hear in-network, think localized, regional. So at Univera Health Plans, we have a broad in-network benefit, and that it'll cover folks in the 8 counties here in Western New York. We also have coverage in the 5 border counties in Pennsylvania, and we extend out into the Rochester region as well with URMC, Rochester Regional. So HMO plans, generally speaking, are great plans for those that are scheduling their care here locally. Scheduling being the key term there. All Medicare Advantage plans have access to worldwide urgent and emergency coverage. That's a common question. If I'm on an HMO, what happens if I'm on vacation? You're still covered. You have urgent emergency care access. The other plan option is called a PPO. It's a preferred provider organization. Little added flexibility in a PPO, and that it provides both in and out of network benefits. So PPO, think flexibility. That is a plan that we generally see our snowbirds in.
I was going to say, people that, travel a lot or have live in different places, not just in Western New York the whole time.
You got it. Yeah, and again, the key term being scheduled, right? So those unforeseen things, you have worldwide urgent emergency coverage, but if I'm a snowbird and I'm spending 6 months in Florida, I'm getting away from these Western New York winters, I'm in Florida for 6 months, and I have to have a primary care doctor here as well as when I'm in Florida, the PPO could be a great option for me. It's going to give me that flexibility. Exciting update for us with the Univera Health Plan for 2025 is we've contracted with MultiPlan, which gives our members access to actually in-network benefits potentially outside of the region.
Oh.
So very portable benefit, flexible with the PPO, but a great starting block really and starting point in that evaluation and selecting coverage for the upcoming year.
Nice. Well, Ryan, since we brought you in, you're kind of the expert. So do you have any advice for those that are shopping for a new Medicare Advantage plan this year?
Absolutely. Right. So kind of three prongs that you really want to focus in. First is obviously access to care. So we talked about HMO, PPO products. That'll be a good starting block, but you want to make sure your providers, your hospital systems are going to be in network with your health plan. Also, you want to make sure you have access to your pharmacies. Okay, so access to care is key. Second to that is really, utilization. I like to say your utilization steers the ship, right? So you want to look at, really in being a good steward of, your premium dollars and making sure that you're selecting appropriate coverage. And utilization can help steer you that way, right? So every premium dollar that you're paying, make sure that your utilization is reflective of that. So looking at your history is a good indicator of what's to come, right? So look at those medical procedures that you've used on an annual basis. But also don't forget that Part D component, which is prescription drug coverage, right? Very important piece of Medicare and really, the overall equation in relation to selecting coverage. Know that all health plans have different formularies, which means drugs that are covered through one health plan may vary with the next. And then tiering can change as well. So when we say a tier, that means that there's copays associated to each of those tiers. Maybe I'm on a tier 1 drug that's a 0 copay with one health plan. Down the road, it could be a tier 2 and carry a cost for you. So again, it's very important to make sure that you're evaluating really that utilization component. And the third factor is, and this has really grown in popularity in the Medicare space, is supplemental benefits. And when we say supplemental benefits, what we're referring to there is like dental, vision, hearing. Advantage plans are also very rich from the standpoint that there's a lot of plan extras. Things like OTC, fitness programs. So a lot to factor in there. The advice is always, take that time, sit down with a dedicated advisor, a Medicare expert, and really review your options for the upcoming year.
Alrighty, Ryan, thank you so much for coming in. You gave us a lot to think about. And viewers, if you would like to learn more about Medicare from our sponsors at Univera Healthcare, you can go to them by visiting myuniveramedicare.com or going to one of their social media pages right there on your screen. Thanks again for coming in, Ryan.
Thank you. Appreciate it.